Every day, more than 500 people around the world hear a life-changing diagnosis: lymphoma, a cancer of the immune system that often strikes without warning. Unlike cancers with obvious symptoms, lymphoma is a silent threat. Its early signs are so subtle, like mild fatigue or a swollen lymph node, that many people ignore them until it's too late. What makes this disease even more dangerous is that the causes are often hiding in plain sight: the shampoo in your bathroom, the plastic you cook with, the air you breathe, and even past viral infections from decades ago. According to the World Health Organization, global lymphoma cases have been steadily rising, with non-Hodgkin lymphoma now among the top 10 most common cancers worldwide. So, why aren't we talking about it more? And most importantly, can you lower your risk before symptoms appear? In this video, we're diving deep into the science-backed causes of lymphoma, many of which you've likely never heard of, and sharing the steps you can take right now to protect your future. Because knowledge isn't just power, it's protection. Please remember, this content is for informational purposes only and should not replace professional medical advice. Always consult your doctor for any concerns. All studies and references are listed in the description below. 1. Occupational exposure. What if the very tools you use to earn a living are quietly increasing your cancer risk? For thousands of workers, this isn't just a possibility, it's a hidden threat. Hairdressers and barbers, for example, handle hair dyes daily, many of which contain aromatic amines, chemicals that have been directly linked to a higher risk of non-Hodgkin lymphoma. These substances are so hazardous that the International Agency for Research on Cancer officially classifies some of them as carcinogenic to humans. But the danger doesn't stop there. Industrial solvents like benzene, toluene, and xylene, used widely in manufacturing, painting, and chemical processing, are also under scrutiny. A significant study published in Occupational and Environmental Medicine in 2010 found that prolonged exposure to these solvents increased the risk of specific lymphoma subtypes, including follicular lymphoma and chronic lymphocytic leukemia. If you work in an environment where chemicals or dust are part of the daily routine, this is a wake-up call. Don't wait for symptoms to appear. Instead, invest in personal protective equipment, insist on proper ventilation systems, and understand exactly what you're being exposed to. Sometimes, what you don't see can hurt you the most. Awareness is your first shield, action is your best defense. 2. Long-term use of certain medications. Could the medications meant to protect you actually be putting you at risk? For many patients battling autoimmune diseases or recovering from organ transplants, immunosuppressive drugs like azathioprine and cyclophosphamide are nothing short of life-saving. But over time, these very medications may quietly increase the likelihood of developing lymphoma. By weakening the immune system to prevent it from attacking your own body or a transplanted organ, these drugs also lower the body's defenses against abnormal cell growth, a pathway through which cancer, particularly lymphoma, can develop. A pivotal study published in the Journal of the American Medical Association in 2017 examined this connection in patients with inflammatory bowel disease, revealing that those receiving thiopurines had a significantly higher incidence of lymphoma than those not using these treatments. Still, it's crucial to understand the full picture. While the risk exists, the absolute risk remains low, and these medications often play a critical role in controlling severe illness. That's why doctors approach immunosuppressive therapy with great care, weighing life-saving benefits against potential long-term dangers. The key takeaway? Stay informed, stay connected with your healthcare team, and commit to regular checkups. Proactive communication and monitoring aren't just good practice, they could make all the difference in catching problems early and staying one step ahead. 3. Smoking. Smoking introduces numerous carcinogens into the body, which can adversely affect the lymphatic system. These harmful substances may lead to genetic mutations in lymphocytes, potentially initiating the development of lymphoma. A comprehensive study published in Cancer Epidemiology, Biomarkers and Prevention in 2005 analyzed data from 9 case control studies. The findings indicated that current smokers had a 31% higher risk of developing follicular lymphoma compared to non-smokers. Moreover, heavy smokers, defined as those with a history of 36 or more pack years, exhibited a 45% increased risk. It's important to note that while smoking has been associated with an increased risk of certain lymphoma subtypes, such as follicular lymphoma, the evidence is not consistent across all studies. Some research has found no significant association between smoking and overall non-Hodgkin lymphoma risk. However, given the established risks and the potential link to specific lymphoma subtypes, quitting smoking remains a crucial step in reducing your overall cancer risk. 4. Obesity and poor diet. Carrying excess weight isn't just about how you look, it can have serious implications for your health, including increasing your risk of developing lymphoma. Research indicates that obesity may lead to a 23% higher chance of developing Hodgkin lymphoma and an 11% increase for non-Hodgkin lymphoma. One reason for this is that fat tissue doesn't just store energy, it also releases various substances that can promote inflammation. Chronic inflammation can damage your DNA over time, potentially leading to cancerous changes in your lymphatic system. Moreover, a diet high in processed foods and low in fruits and vegetables can deprive your body of essential nutrients and antioxidants that help protect against cancer. For instance, consuming ultra-processed foods has been linked to an increased risk of obesity, heart disease, and cancer. It's not just about the numbers on the scale, it's about what you eat and how it affects your body's internal environment. By maintaining a healthy weight through a balanced diet rich in whole foods, you can reduce your risk of lymphoma and improve your overall well-being. 5. Family history of lymphoma. Having close relatives who've battled lymphoma can indeed heighten your own risk. Studies reveal that individuals with a first-degree relative, parent, sibling, or child diagnosed with non-Hodgkin lymphoma are about twice as likely to develop the disease themselves. This increased risk isn't solely due to shared environments or lifestyles. Research indicates that genetic factors play a significant role. For instance, a comprehensive study published in Blood in 2015 found that familial risks are elevated across multiple lymphoma subtypes, suggesting a shared genetic predisposition. It's essential to understand that while a family history can increase risk, it doesn't guarantee you'll develop lymphoma. Many with a familial link never experience the disease. However, being aware of this risk can encourage proactive health monitoring and discussions with healthcare providers about personalized screening strategies. 6. Autoimmune diseases. Living with an autoimmune disease means your immune system mistakenly attacks your own body's tissues. This chronic state of inflammation can sometimes lead to complications, including an increased risk of developing lymphomas. For instance, individuals with Sjogren's syndrome face a significantly higher risk, nearly 40 times more likely, to develop marginal zone lymphoma, a type of non-Hodgkin lymphoma. The persistent immune activation in autoimmune diseases keeps your lymphocytes, a type of white blood cell, constantly active. Over time, this heightened activity can cause genetic mutations in these cells, potentially leading to lymphoma. A comprehensive study published in the journal Blood analyzed data from 12 case control studies, highlighting the association between various autoimmune conditions and an increased risk of different non-Hodgkin lymphoma subtypes. It's essential to understand that while the risk is elevated, not everyone with an autoimmune disease will develop lymphoma. Regular medical checkups and open communication with your healthcare provider can help monitor and manage any potential complications. Staying informed and proactive is key to maintaining your health. 7. Exposure to toxic chemicals and pesticides. Did you know that certain chemicals we encounter daily might increase the risk of developing lymphoma? For instance, benzene, a solvent found in products like paint thinners and pesticides, has been linked to non-Hodgkin lymphoma, NHL. A study by the University of California, Berkeley, highlighted a dose-dependent relationship. Higher benzene exposure correlated with a greater risk of NHL, particularly the diffuse large B-cell lymphoma subtype. Pesticides are another concern. Research published in BMC Medicine examined California residents with NHL and found that those in areas with high agricultural pesticide use had poorer survival rates. This suggests that environmental exposure to these chemicals not only contributes to developing lymphoma but may also affect outcomes after diagnosis. It's not just occupational exposure that's worrisome. Everyday items such as black plastic kitchen utensils can contain toxic flame retardant chemicals. A recent study found high levels of bromine, a component of brominated flame retardants, in 20 out of 203 screened products. These chemicals can disrupt hormones and have been linked to cancer, including lymphoma. While it's challenging to avoid all chemical exposures, being informed helps us make safer choices. Opting for natural cleaning products, using wooden or stainless steel utensils, and supporting organic farming practices can reduce our contact with potential carcinogens. Staying aware and making mindful decisions are steps we can take to protect our health. 8. Exposure to radiation. Ionizing radiation such as X-rays and gamma rays has the potential to damage the DNA within our cells. This damage can lead to mutations which may cause cells to grow uncontrollably, resulting in cancers like lymphoma. The risk is influenced by factors including the dose of radiation, duration of exposure, and individual susceptibility. Recent research has provided more insights into this connection. A study published in The Lancet Hematology in 2012 analyzed data from approximately 310,000 radiation-monitored workers. The findings indicated a positive association between prolonged low-dose exposure to ionizing radiation and an increased risk of mortality from hematological malignancies, including lymphoma. It's important to note that while this study highlights a correlation, the overall health risk remains low at low exposure levels. Nonetheless, these findings underscore the importance of adhering to safety protocols when working with or around ionizing radiation to minimize potential health risks. 9. Human T-cell lymphotropic virus type 1, HTLV1. HTLV1 is a retrovirus that infects T cells, a type of white blood cell crucial for our immune defense. While many carriers remain asymptomatic, approximately 5% may develop adult T-cell leukemia or lymphoma, ATL, decades after infection. The virus integrates its genetic material into the host's DNA, leading to the production of viral proteins like TAX and HTLV1 BZIP factor, HBZ. These proteins interfere with normal cell functions, promoting uncontrolled cell growth and inhibiting natural cell death processes. Over time, this disruption can result in the transformation of healthy T cells into malignant ones. A recent study published in Blood, 2023, highlighted that HTLV1 persistence and the oncogenesis of ATL are closely linked to the virus's ability to evade the host's immune system, allowing infected cells to proliferate unchecked. Understanding these mechanisms is vital for developing effective treatments and preventive strategies against HTLV-1-associated lymphomas. 10. Helicobacter pylori infection. Chronic infection with Helicobacter pylori, a bacterium commonly found in the stomach, has been closely linked to the development of gastric mucosa-associated lymphoid tissue, or MALT lymphoma. This connection stems from the bacterium's ability to induce prolonged inflammation in the stomach lining. Over time, this persistent inflammatory response can lead to the formation of lymphoid tissue not typically present in the gastric mucosa. The continuous stimulation and proliferation of B lymphocytes within this newly formed tissue increases the likelihood of genetic mutations, which can ultimately result in the emergence of MALT lymphoma. A significant factor in this process is the H. pylori virulence protein known as cytotoxin-associated gene A, or CAG-A. Once introduced into gastric epithelial cells, CAG-A can disrupt normal cellular functions, promoting abnormal cell growth and survival. This disruption not only contributes to the development of gastric cancer but also plays a role in the pathogenesis of MALT lymphoma. Notably, a systematic review and meta-analysis published in the Journal of Health Population and Nutrition in 2021 examined the impact of CAG-A-positive H. pylori strains on the risk of developing gastric MALT lymphoma. The study highlighted the complex and sometimes controversial role of CAG-A in increasing lymphoma risk, emphasizing the need for further research to fully understand this relationship. Importantly, the eradication of H. pylori through targeted antibiotic therapy has been shown to induce remission in a significant number of patients with early-stage gastric MALT lymphoma. This therapeutic approach underscores the critical role of H. pylori in the disease's development and progression. By eliminating the underlying bacterial infection, the stimulus for chronic inflammation, and subsequent lymphoid proliferation is removed, allowing for the regression of the lymphoma in many cases. This treatment strategy not only addresses the root cause but also offers a less invasive alternative to more aggressive cancer therapies. 11. Epstein-Barr virus, EBV. Did you know that over 90% of adults worldwide carry the Epstein-Barr virus, or EBV? While it's usually harmless, EBV can sometimes lead to certain types of lymphomas. This virus targets B cells, a type of white blood cell, and can alter their behavior. In rare cases, these changes can cause the cells to grow uncontrollably, leading to lymphoma. A recent study published in the Journal of Virology, 2019, delved into how EBV influences B cells. The researchers found that EBV can activate specific pathways in these cells, promoting their growth and survival. This activation can sometimes push the cells toward becoming cancerous. It's important to note that while EBV is linked to certain lymphomas, most people with the virus never develop cancer. Factors like a weak immune system can increase the risk. Staying informed and maintaining a healthy immune system are key to reducing potential risks. 12. Immune system suppression. When your immune system is suppressed, its ability to detect and eliminate abnormal cells diminishes. This reduction in surveillance allows potentially cancerous cells to proliferate unchecked, increasing the risk of developing lymphomas. For instance, individuals undergoing organ transplants are prescribed immunosuppressive medications to prevent organ rejection. While essential, these drugs can inadvertently raise the likelihood of non-Hodgkin lymphoma, or NHL. Similarly, autoimmune diseases like rheumatoid arthritis often require treatments that dampen immune activity. Although these therapies manage autoimmune symptoms, they can also elevate lymphoma risk. A study published in Blood, 2008, highlighted that certain autoimmune disorders are associated with an increased risk of specific NHL subtypes, underscoring the complex relationship between immune modulation and lymphoma development. Moreover, infections such as HIV significantly weaken the immune system, further compromising its cancer-fighting capabilities. People with HIV have a higher incidence of lymphomas compared to the general population. In essence, any condition or treatment that suppresses the immune system can inadvertently create an environment conducive to lymphoma development. It's crucial to balance the benefits of immunosuppressive therapies with their potential risks, and to monitor individuals under such treatments for early signs of lymphoma. 13. Genetic mutations and chromosomal abnormalities. Lymphoma, a cancer of the lymphatic system, often arises due to specific genetic mutations and chromosomal abnormalities. One common genetic alteration is the translocation between chromosomes 14 and 18, frequently observed in follicular lymphoma. This translocation places the BCL2 gene next to the immunoglobulin heavy chain locus, leading to overexpression of the BCL2 protein. As a result, the affected B cells evade programmed cell death, accumulating abnormally and contributing to lymphoma development. In diffuse large B-cell lymphoma, mutations in the MYC gene are prevalent. The MYC gene encodes a transcription factor that regulates cell proliferation. When mutated, it can lead to uncontrolled cell growth, a hallmark of cancer. Additionally, mutations in the BCL6 gene, which normally helps B cells mature, can disrupt their development and promote lymphoma. Recent research has further illuminated the genetic landscape of lymphomas. A 2023 study published in Clinical and Translational Oncology emphasizes the role of genetic profiling in diagnosing and managing lymphomas. The study highlights that specific genetic mutations can influence patient outcomes and responses to therapy, underscoring the importance of personalized treatment approaches. Understanding these genetic factors is crucial for developing targeted therapies and improving patient care. By identifying and studying these mutations, researchers and clinicians can better predict disease progression and tailor treatments to individual genetic profiles. The truth is, lymphoma doesn't arrive with a warning siren. It creeps in silently, shaped by the air we breathe, the infections we've fought, the habits we maintain, and even the jobs we once held. But now you know more than most. You understand the hidden risks, the subtle connections, the overlooked causes. This knowledge gives you a rare advantage, the chance to be proactive, to have smarter conversations with your doctor, to adjust your lifestyle in meaningful ways, and maybe, just maybe, to save a life, whether it's your own or someone you love. If this video helped you see lymphoma from a new perspective, don't let it stop here. Hit the subscribe button and turn on notifications so you never miss critical updates about your health. Share this video with friends or family, because awareness spreads faster than disease. Thanks for watching Golden Vitality, where your health is our top priority. Until next time, stay informed, stay empowered, and most importantly, stay well.